Welcome to Healthy Focus, the Duke Raleigh Hospital Community Education Series.
Please join me in welcoming Dr. Kevin Speer.
Thank you, Mandy. You can hear me?
Yep.
Welcome to the Healthy Focus series. My name is Kevin Speer. I'm an orthopedic surgeon here at the hospital. I've been privileged to do these in the past on various shoulder topics. And tonight we're going to be speaking about a simple approach to managing shoulder pain. Again, I can't quite tell if everybody can hear me in the back. You can. Excellent. So I will proceed and not ask that question again. So this is more of an approach towards dealing with pain in the shoulder, and which is sort of a common occurrence, and hopefully some simple strategies. Then afterwards, there's always some very pertinent, interesting questions, and we can sort of take questions afterwards as you would like. Where I would start with this talk is, what we're talking about tonight is what you see on the bottom here. So pain in the shoulder that occurs when you use it or when you have certain activities. So I'm not really talking about pain at rest or pain at night when you're trying to sleep. So in my practice or in my approach as an orthopedic surgeon, if someone tells me they have pain at night is a more difficult animal. It's a more challenging problem. It generally reflects more pathology or more difficult, difficult clinical challenges. Because generally, if your shoulder hurts all the time, you're not using it. A lot of my strategies in terms of activity moderation or adjusting it or exercising it and all that aren't going to help as much. So what we're talking about tonight mainly is pain with activities that make it hurt. So what makes the shoulder hurt? It's actually a fairly simple metric, very simple, is that usage exceeds demand, meaning what you are doing, what you're asking of the shoulder to do is more what the shoulder can handle. And that results in pain, it results in discomfort. Now, that metric is influenced by the amount that you do or the intensity with which you do it, or the quality of your shoulder. I mean, is your shoulder normal? Is it diseased? Is it torn? But basically, it's a supply and demand mismatch. This is relevant as we get older, because as we all get older, the shoulder becomes more vulnerable to perturbation, to stress. The shoulder exhibits, in the medicine, we call it a senescent change, an age-related change. It's like this, it's like gray hair. The shoulder does this as much or more so than most other joints in the body. So as we get older, the common occurrence or the common observation, and get older meaning this, you can get into your early 50s with this, or late 40s with this, you say, well, I'm not doing anything different now than I did 10 years ago, but now it's hurting. Why? Well, because things aren't as they used to be. So what happens as you get older in the shoulder? A number of things occur. So these are normal physiologic findings. It's like your hair going gray. It just means you're not 20 anymore. Bone spurs form. So the edges of the bones develop a sharper edge. And those sharp edges can pinch. In the shoulders, bone spurs pinch on tendons. Makes tendons hurt, makes tendons tear, causes bursitis, which is a lot of the pain in the shoulder. The neck gets spurs too, and when spurs in the neck form, they pinch. But in the neck, they pinch nerves. So you get a different pattern of pain. So the shoulders get spurs. Tendons deteriorate and tear. Tendons soften. They just soften as you get older, especially the top tendons in the shoulder. So generally by the age of 70, 1 in 3 of us have a tendon tear in the shoulder. Not because you've hurt it, not because you've been injured, or not because you hurt. Just because you're 70. And that's just sort of a normal physiology of aging. Cartilages soften and tear, muscles weaken, of course. The muscles weakening has a lot to do with activity, but also hormones, it's physiologic. And bone soften as we get older, but bone softening, that is osteopenia, osteoporosis, has nothing to do with shoulder pain. Now, it might make your shoulder more vulnerable to breaking if you fall on it, but in and of itself, osteopenia and osteoporosis is not a symptomatic problem. So the initial considerations, the most simple considerations for dealing with a painful shoulder is simply adjusting your lifestyle, of course. I mean, in much of this you've already concluded, most everyone concludes intuitively, and you don't need my reinforcement for it, but I need it to be said because this is sort of a launching point for us to go forward. But making lifestyle choices. I mean, certain things, you've discovered that certain things make your shoulder hurt, and the simplest of all the possible solutions is stop doing those certain things. And the question is that a desirable solution? Is that a desirable consideration? Sometimes it is, sometimes it isn't. Or you can just treat the symptoms, meaning say, after 18 holes of golf, your shoulder always aches. You get it, you figured that out. Okay, so one thing you can do is just take some ibuprofen before you play golf. You're not improving the shoulder or rehabbing the shoulder or changing the shoulder, doing anything to the shoulder to make it any better or more resilient. You're just anticipating symptoms and cutting it off at the pass, and hopefully it works. And if it does, it's just that simple. But when it's not that simple, or you want a more engaged consideration, which is probably why most of you are here tonight to listen to some of my thoughts about the shoulder, there's a lot of other things that we can take from this point on. But the important place to start is, you say, well, my shoulder hurts. Let's be sure we're talking about the shoulder. And I think it's an important consideration, because certainly in my practice, I'll have people come in and they'll say they'll have shoulder pain. And I always ask them, well, where does it hurt? So shoulder pain that rises from the shoulder, it generally hurts in the front or on the top, or especially on the side. And you'll ask them, to grab the area. So this is the most common area here. But also what's very common in the shoulder is that it can hurt down the arm. It radiates down here. Now, there's 3 areas in the body that radiate pain routinely: the neck, the back, and the shoulder. So it may be in the shoulder you have tendon tears and spurs and bursitis and all myriad of things, and the pathology is truly up here. The pain may be very well down here mid-arm. Now, that's not the most common scenario, but it definitely exists, and it can be very confusing to people. If the elbow hurts somewhere, it hurts in the elbow. Generally, if the knee hurts somewhere, it hurts in the knee. And then you can have some radiation. But the shoulder can really radiate pain down. That's just a phenomenon of how we're wired, how God made us, just the way the nerves are on the shoulder. So a fluke of how the shoulder's put together. A hallmark of shoulder pain is that it's worst when you raise your arm. Because the rotator cuff, the spurs, all these become pertinent and engaged when the arm is put away from the side. Many people you can have a pretty bad shoulder, and most people feel pretty reasonable keeping their hands in close, even with a very diseased shoulder joint. Sometimes the shoulder could even hurt, along the back here. This is less common, but still, when someone says, well, this is where I hurt, along the back, and kind of grab the back of their shoulder, that's pain from the shoulder, and we'll get to that more, what that means in a moment. Or is the pain from the neck. Now, this is very pertinent to, those of us in the audience probably over the age of 50, because as we get older, the shoulder develops spurs. That's normal, just like gray hair. That's normal. The neck develops spurs too. Everyone's does. So the question is, where does it hurt? So I have patients come in, you say, well, my shoulder hurts, and they'll start pointing to places like this, in the back of the shoulder here, or up in here. So this is neck pain. And sometimes, for many people, it's intuitive. You say, well, of course, that's the neck, not the shoulder. But I'll tell you, there's a lot of people who I see who state shoulder pain. They say, yeah, it hurts, and then they'll point to the top of their shoulder here, or the base of their neck. Or they'll point to the back of their shoulder and base of the neck in here. This locus of pain here or back in here, That's from the neck. That's not from the shoulder. Many times they'll point back and through here, and some people refer to this as their shoulder. But I mean, so pain in here, if that's where your pain is, that's from the neck. That's not from the shoulder. Meaning it's a pinched nerve, or it's a sprain, or it's arthritis, or something from the neck. But it's not from the shoulder. The other thing about neck pain is that commonly neck pain is provoked when you provoke the neck. So people will think, well, it hurts here, and it gets worse, when I move my head in a certain position. That's the neck pain. And it can radiate down between your shoulder blades, it can radiate in the back around your shoulder blades. So that could be all from the neck. And this is complicated stuff. It's not as, I have a lot of my orthopedic colleagues, and I have neurosurgery colleagues who deal with this neck, and we're constantly exchanging patients back and forth trying to figure out, it's not like, well, is it shoulder or is it neck? Usually it's both. But the question is, what's the dominant feature? Where do you start? You got to start somewhere to treat it. There's a crossover pain area, so when people get right in the back here on the top of their shoulder blade, that can be caused from all sorts of things. From the neck pain coming down, shoulder pain coming back, shoulder blade pain here, and it can become very complicated. You can imagine, we're not really talking tonight about the clinical practice of dealing with shoulder stuff, but much of it is the most fruitful way to alleviate someone of, talking about shoulder pain, is to have a directed approach. Here's your problem. This is why it hurts. It's how we're going to treat it. And so the more precise your diagnosis, the more likely you'll have some clinical success with it. So a good rhetorical question to launch to the next phase of the talk is, well, why do you want less shoulder pain? Well, because you want to engage the activities that you want to participate in. And it could be whatever. I have people say, well, I'm not very active, so what do you do? So, well, and a good example I like to hear is gardening. I just garden. Well, gardening, it's pushing, pulling, lifting, and then transporting things in mulch, and I thought this was a good illustrative picture. For some reason, this woman has chosen to sit down. If you're gardening, if you're sustaining this posture of your arm, that is provocative to the shoulder. Trust me. The shoulder's not going to like that. If your shoulder has anything wrong with it, it's not going to like that positioning. People say, well, gardening isn't that strenuous. Well, it can be, depending on how you position yourself. Now, an easy thing for her to do if her shoulder bothered her, the simplest thing would be stand up and do it, but maybe she doesn't stand because she's got arthritic knee. And it's not so simple, is it? People talk about tennis, very demanding the shoulder. Tennis is demanding the shoulder, but the shoulder was designed to position the hand in space. So the shoulder, in terms of its muscles, the rotator cuff, really is engaged when the elbow's away from the body. It's not in here. So when your arm is down, you can have a lot of shoulder pathology, arthritis, tears, spurs, damage, whatever. And the shoulder can behave pretty good, which means, so if you like to play tennis, fine. And if you keep yourself to more of the backhands from the waist down, you can have a pretty not very good shoulder and play tennis well. Now, you're not doing anything overhead. So it's not a matter of saying, well, tennis is hard for the shoulder and gardening is easy. It's all, like most things in life, it's more complicated than that. So let's talk about treating the shoulder symptoms. The symptoms in the shoulder, the pain you get, is an inflammatory mediated pain. It's inflammation. Now, it could be bursitis, it could be synovitis, it could be arthritis, or whatever. It's mediated through the inflammatory cycle. So, taking an anti-inflammatory medicine is generally quite effective. There's a whole variety of them. And I kid patients about like flavors of ice cream. So which one's better? Is it Aleve or is it Mobic or whatever? Nah, they're all fine. But they're different. They're once a day or twice a day or 3 times a day. Much of it, even though they're all the same category and they're very chemically similar, it's remarkable the differences people have with different medicines. That Aleve doesn't work at all, ibuprofen works great. Interesting. Next patient. Ibuprofen is terrific, Aleve doesn't work at all. Interesting. Why? Who knows why? But it's because you're biochemistry. But still, which means anti-inflammatory medicines are generally a good strategy, simple strategy, and they generally work. And if you've tried something that doesn't work, before you give up, try something different. Try an alternative. try, meloxicam. But once you get away from the Aleve and the Advils, the ibuprofens, and the naproxens, then you need a prescription. But these are just as good. The problem with anti-inflammatory medicines is they got side effects. Well, everything has side effects. But side effects here, mainly to worry about stomach upset, heartburn, which fortunately is not a subtle symptom. So if you're taking these medicines and you're obviously if you have pain, that's the obvious. But say you have nausea or indigestion feeling, that's the medicine. You better stop it. Patients will say, well, but it helps my shoulder. True, but your stomach is always more important than your shoulder. So, and there's other medicines to try. There's various prescription medicines that are a little bit more protective. But anti-inflammatory medicine, as a general rule, is good. Now, nowadays there's a lot more people on blood thinning medicines for all various reasons, either heart stents or whatever. And generally speaking, the cardiologists are mostly not favoring the use of anti-inflammatory medicines if you're on blood thinners, which is what it is. It's like you may have a simple shoulder problem, some bursitis, a bone spur that bothers you a little bit. It's not too significant from an orthopedic perspective in getting it better. The problem is simple remedies you can't handle simple remedies. You can't take ibuprofen or anything. Why? Because you're on Epic, you're on Prodaxa, you're on whatever. Your cardiologist says no, to Xarelto. So if you can't take it, you can't take it. But if you can take it, it's easier. Cold therapy is great for the shoulder. When the shoulder hurts, cryotherapy is effective and it works well. Now, cold is cold. You want to put an ice bag of frozen peas, a freezer pack, whatever, doesn't matter. But cold is cold. But cold works very well. It is a phenomenon of, again, how the shoulder is wired. Of course, we're wired everywhere like this. But, cold can help decrease swelling to some extent, but, really, cold doesn't decrease swelling as much as you think, because it doesn't penetrate that deep. You really have to get it really cold to penetrate, through the skin, through the subcutaneous fat, through the deltoid down the shoulder. It really doesn't chill the deep shoulder. The reason cold works is that the nerves that relay temperature, heat and cold and vibration, those three things, are bigger nerves, and the nerves that relay pain are tiny little nerves, thinner nerves. And for some reason, if a pain nerve and a nerve that carries cold simultaneously are stimulated. You got a painful shoulder and you just put an ice bag on it. For some reason, when the brain sorts through this, what the sensation that wins out is cold. In the neural pathways, if cold and pain are traveling up the same spinal cord tracts, cold wins. So it sort of tricks the brain into feeling cold, which means you're substituting cold for pain. Now, hopefully you like cold. I ask some patients who will say, well, I put cold on my shoulder and I don't like it, it makes me feel chill. I said, well, that's okay. So now you got a choice. But so it's not making your shoulder better, it just makes it feel better. It just tricks it into feeling not painful. And sometimes that's the difference between having a comfortable evening and not a comfortable evening. So cold is effective. Be careful if you're using ice bags and all that, because you got to be worried about thermal injury to the skin. So you should really, if you use an ice bag, put it over a t-shirt or something like that. What's nice about like a bag of frozen peas or a bag of frozen corn, one, they're like bean bags. First off, they mold well. And second, just when the skin needs relief, it's melted about 20 minutes, so it's nice. The problem is, a few cycles of that, they get a little smelly, especially peas. Corn's better because corn doesn't smell as bad. In the clinical setting, the most definitive way to alleviate your shoulder's inflammation or pain is a cortisone shot. Cortisone shots are used all over within orthopedics, and some areas they work better than others, but probably one of the top 2 or 3 areas in the body that really respond well to cortisone is in the shoulder. it responds well. It's a big bursal space, it's a painful space, it's easy to inject, so it's something to consider if all else has failed, in terms of just alleviating the symptoms. So here's a trick as well. So your shoulder hurts. You've done some activity and you need some relief. Elevate your shoulder above your heart. Now, I think people intuitively understand. So if you were walking out of here tonight, God forbid, and you slip on the sidewalk and you twist your ankle, you don't break it. Let's say you twist it, and it hurts. And you get home and you look down and you go, oh my God, it's swollen, and it's throbbing, and it's aching. I bet you most everybody in the room intuitively knows, well, I need to get off my feet and lay down and get my foot above my heart. You intuitively know that. Well, same thing for the shoulder. If the shoulder's aching and hurting, it has the same inflammatory issues. If you get your shoulder above your heart, you have to elevate your torso, which means you have to sleep propped up. You can do it in bed with pillows, fine, or but also some sort of a recliner. But this is a nice tool, and if any of you have ever had shoulder surgery, you will, even if your surgeon never even tells you this, you will quickly learn through trial and error when to sleep is something like this. You got to sleep propped up. But this could be a very effective mechanism because it relieves the hydrostatic forces of the shoulder just enough that it really can take an edge off it. It can be effective, especially when you're searching for all sorts of remedies. I mean, you ibuprofen, it doesn't help, and the cold, you don't like the cold, and your shoulder aches, and it just happens occasionally. It's a nice remedy that might be a simple solution rather than having to go and see the doctor for it. One thing I always like to emphasize is never underestimate the importance of good nutrition when it comes to it. You know, a lot of people, as we get older, everyone gets gray hair. Everyone gets spurs in their shoulders, soft tendons start to tear. But some people, their shoulders are more resilient naturally than others. Now, that can do with genetics. That can do with how strong you are resilient. That can do with your pain threshold and other factors, of course. And comorbid symptoms like diabetes and things like that. But I also think that some people's bodies are more antioxidant, meaning have a greater capacity to tolerate inflammatory stress. And a more extreme example of the opposite might be a condition like fibromyalgia. We're seeing like everything aches all the time. They can't figure out why your body starts inflaming everywhere. But one thing is important is diet. And there are supplements you can use like fish oils, antioxidant diets, things like walnuts, pecans, fish, blueberries, things like that. But don't underestimate the importance of a diet rich in antioxidants to someone that if it just seems like you're always achy and sore and you just can't take an edge off it. I mean, it's not going to make an arthritic shoulder stop being painful, but it can take edges off things. And sometimes you take a few edges off things with a few simple remedies. That's the difference between living with something you know you have and having to go to the doctor and deal with something that you'd rather not have to deal with. I think that part of getting the shoulder better is you got to stay active. And even if it means not necessarily exercising your shoulder, which I think is important, but even just walking, just exercising your body, keeping your body fit. Healthy bodies have healthy shoulders, or at least healthy bodies can have healthy shoulders. So you need to stay active. And even if it's a matter of just walking, but just walking and creating a little cardiovascular health, a little bit of greater fitness and endurance, it makes your body more healthful when it's dealing with things for your shoulders. So it's not a matter, you don't necessarily have to say, well, I gotta do shoulder exercises. You gotta do something. You gotta do something, even if it means just walking every day. So an age-defying shoulder, or a shoulder that sort of behaves as you want it to behave, meaning as you're getting older, that the shoulder is not the rate-limiting step or consideration as to what you do and don't do with your life, your lifestyle, your activity choices. In many people, it does require some maintenance exercise because the shoulder is more prone to muscle loss and weakness because it's not anti-gravity. We don't walk on our hands. And some people just have a propensity towards the shoulders just get weak. And you need to exercise. But exercising the shoulder, when you